The United States crossing what President Biden calls a tragic milestone, 1 million deaths from COVID since the start of the pandemic more than 2 years ago. The White House marking the day by lowering flags to half staff until Monday. President Biden also addressing a second virtual COVID global summit. He thanked workers who've been on the front lines for more than 2 years. He said, "We don't need to let this become routine. It's still so horribly sad." The president urged world leaders to step up their efforts to control the pandemic.
We can do this. We can control COVID-19. We can start to build a better, healthier, and more secure future today if we all do our part and if we step up together.
President Biden calling for Congress to pass more funding for testing, for vaccines, and especially for treatments. All of this as COVID cases are, without question, rising yet again in many parts of the country. CNBC's Meg Terrell covers science and medicine for us. She's been our rock during this pandemic. It certainly isn't over, Meg.
No, Shep, sadly, it's very much not. Cases and hospitalizations are both rising nationally now. Cases up to more than 80,000 a day on average. And while hospitalizations are up 20% over the past week, we have been hearing from health officials that the nature of those cases has been different. Not so many people in the ICU are needing ventilators, likely due to the population having so much built-up immunity from infections, vaccinations, and boosters. And on that front, we haven't seen deaths rise dramatically, although the U.S. is still reporting more than 300 per day. Right now, the highest transmission is happening in the Northeast and a bit in the Midwest, although it is picking up in multiple spots around the country. Part of what may be driving cases higher is a new subvariant of Omicron known as BA.2.12.1. It's estimated to be 25% more transmissible than BA.2, which itself was more transmissible than the original Omicron. And it's been gaining in prevalence, now making up more than 40% of cases sequenced nationally. And it's most dominant in the Northeast, making up 2/3 of new cases there. And health officials are concerned that as it spreads to areas of the country that have lower vaccination and booster rates than the Northeast, it could lead to more severe disease, potentially putting more strain on the healthcare system. All of this comes amid the fight in Congress over new COVID funding, emphasized again today at the White House Global COVID Summit. The White House's COVID response coordinator, Dr. Ashish Jha, has warned Congress needs to act within weeks in order for the U.S. to place new orders for fall boosters, expected to be updated to address newer strains of the virus.
You mentioned the Northeast, Meg. You know, New York and New Jersey, I know so many people who have it right now. A lot of them aren't sick, thankfully, but some of them are. Some of them are very sick. And you wonder what happens when this begins to spread to other parts of the country you mentioned, where the vaccination rates are nowhere near ours.
Yeah, and experts point out, Shep, a lot of us know more people now who are getting COVID than we've really essentially known in the last 2 years. There is so much home testing going on that these numbers are not picking up how much infection is actually out there.
No, I know at least a dozen. And staffing a program isn't always easy these days. Meg Terrell, it's great to see you. Thank you.
It is tough.